I'm Jeff Litt. I am the Burn Medical Director at Chippenham Hospital in Richmond, Virginia. And today I am here with some friends to talk about some of the dangers and things to look out for when you're having your beautiful campfires or bonfires, fire pits in your backyard this beautiful fall. As the weather has gotten a little cooler, people really like being outside, and we often see a number of different kinds of injuries at our burn center. Probably the most common one we see is when people use accelerant on their fire that's just not getting lit up quite fast enough. And the most common one we see of that is gasoline making just a huge volatile explosion, causing really significant burns to the face, to the anterior neck and chest, often to the hands. One of the things that I tell people all the time is don't use accelerants on your fire. If it's not catching quick enough, give it a little bit of time and put in a little bit more tinder. Maybe build it a little differently, but accelerants are just a bad idea.
Thanks for joining me today. My name is Lieutenant Chip Loving with Chesterfield Fire and EMS, and I'd like to share a few pointers with you to make sure that you're safe this season. Open fires can be a lot of fun, but they can also have some dangers and hazards that we need to make sure that we are taking care of. Let's make sure that your area is free of clutter. We want to ensure that any trip hazards are removed from the area so that folks aren't falling in. We want to make sure that we have a hose nearby in case there's an emergency or the fire gets out of control, that you can control it. Make sure that while you're burning that you stay with the fire. Somebody needs to be out supervising it to make sure that it doesn't spread or act unpredictably. If you're using a fire pit that has the mesh screen, make sure that you're actually using that mesh screen. That's actually designed to help keep embers from going up and away from the fire. Make sure that once you've put the fire out after you're done burning, that you've put water on it and allowed it proper time to cool. A fire can stay warm for a long time. The embers and the ashes can actually stay warm for a very long time.
Alcohol and open fire just really doesn't mix well, especially if you're gonna drink more than just a single drink or two. We take care of people who might have more than one or two, not infrequently as well, and much like children, they just happen to fall into the fire by accident. They have some difficulty extricating themselves from the fire, and they often get deeper burns, more severe burns, more extensive burns, almost always requiring some kind of skin grafting procedure. Anyone who ends up sustaining a burn injury should be seen by a burn professional, unless it's a very, very small burn that you can put an antibacterial ointment on. Most of the burns that we see can be much more serious if they're not looked at and taken care of properly. And really a burn center and a burn clinic is the best way to get that taken care of quickly, properly, and to prevent some serious scars later on in life as well.
Just make sure that you're surveying your area when you're doing any kind of open burning to ensure that you and your family are safe this season.
Thanks for your time. That little extra forethought will prevent you having to see someone like me